Allison. I'm here to speak to you today. We are covering Monroe's motivated sequence. And my step is step 1, attention. We're going to cover the subject of breast cancer, and our leading thing is why we care. Is today the day that you could save your life? By taking several minutes once a month to perform a self-breast exam could change your future. The American Cancer Society estimates that in the United States there are 207,000 new cases of breast cancer for 2010. Every 3 minutes, a woman is diagnosed with breast cancer. Every 13 minutes, one will die from the disease. These are alarming numbers in our society today. African American women under the age of 45 are more likely to die from breast cancer. Breast cancer can affect anyone, including men and women. The American Cancer Society stated in 2010 that there were 19,070 cases of breast cancer diagnosed in males. In that group, 390 died from the disease. In males, it is rare, but as you can see, it can happen to anyone. The month of October is Breast Cancer Awareness Month. This is time to reflect back on our loved ones who we've lost and their lives to breast cancer. It is also a time to reach out and give support to the community. Education and research is the key to detect early signs of breast cancer. The Susan G. Komen organization recommends females should begin self-breast exams in their 20s and see a clinician every 3 years. A mammogram should begin at the age of 40 and repeated every year of high risk. In the United States, the death rate began to decrease in women with breast cancer due to early screening and detection for mammograms and treatment. Women with breast cancer can be diagnosed at an early, localized stage at a 60% success rate. Women and men should be aware of their breast. By performing a breast exam each month, an individual can become familiar with changes in the breast tissue. The exam involves looking and feeling the breast to alert oneself to any changes that may occur during the initial screening stage. A lump that is discovered in the breast should be taken serious. An appointment should be scheduled with a professional as soon as possible. Will you take the steps today to screen for breast cancer to be able to change your life forever? When you find a tumor, you are alarmed. A tumor in the breast may be malignant, which is cancer, or benign, which is non-cancer. This may develop from cells in the breast. Breast cancer can begin from cells in the milk-producing glands or the passages that drain milk into the nipples. Over time, the cancer can invade the lymph nodes under the arm. This is how cancer spreads throughout the body in certain cases. There are stages that breast cancers are staged. Stage 0, cancer cells remain in the duct with no spreading to other tissues. Stage 1, cancer is less than 2 centimeters with no spreading. Stage 2A, cancer has spread into the lymph nodes. Stage 2B to 3C is the growth and size of the tumor is larger and may have spread into the lymph nodes and near the breastbone. Stage 4, the cancer has spread into other areas of the body. Some of the symptoms that you may see could be any new hard lump or thickening in any part of the breast, changes in the breast, dimpling or puckering of the skin, swelling or warmth that does not go away, pain in one spot that does not change with monthly cycles, pulling of the nipples, nipple discharge that starts suddenly and appears in only one breast, an itchy, sore, or scaling area on one of the nipples. At any time any of these signs and symptoms are discovered, please see a doctor as soon as possible. A mammogram may be scheduled at that time. A mammogram is an image test that is non-invasive. It uses low dose of x-ray during a breast exam. It produces images of the inside of the breast. The breast is placed in a device that compresses the tissue. It is not uncomfortable by any means. The x-ray will be performed and the patient must remain very still. The process may take 30 to 40 minutes. After the test, the radiologist will review the films to make sure there are no further x-rays needed. At some times, the x-rays are not clear, so they must be repeated before the patient leaves. This way, it takes time out of their schedule, so that way they don't have to reschedule to make a special trip. Within any time, the doctor will call you and give you results, and then that way further examinations will take place. Please take the time to perform a self-breast exam monthly. It only takes a few moments and it may save your life. Thank you for listening to my speech today, and I hope you perform your self-breast exams.